Good afternoon. My name is Nicholas Hanle, and today I'm going to be discussing with you cardiac output and autonomic nervous system influences on cardiac output. For this presentation, I have three main objectives. The first will be to explain what cardiac output is and how it works. Next, I would like to explain the relationship between cardiac output, heart rate, and stroke volume. And finally, I'd like to compare and contrast the effects of the parasympathetic and sympathetic nervous systems on cardiac output. So first of all, let's talk about what is cardiac output. Cardiac output is simply the volume of blood that is pumped by each ventricle per minute. It's not the total amount of blood pumped by the heart, it's from each ventricle each minute. At any point, the volume of blood that's flowing through the pulmonary circuit is equal to the volume of blood that's pumping through the systemic circuit. For this reason, the cardiac output from each ventricle is normally about the same. Now, obviously, there could be a little minor changes there, but for the most part, under normal conditions, systemic circuit volume should equal the pulmonary circuit volume, so that pumps equal. So if we look next, the cardiac output depends on the heart rate and stroke volume to determine the value. Heart rate is measured is the beats per minute of the heart, so how many times the heart beats per minute, and your stroke volume is the volume of blood that is pumped per beat or stroke. Okay, if we take these two numbers and multiply them together, it gives us the cardiac output for that particular time. So on average, the normal resting heart rate is about 70 beats per minute, and the average resting stroke volume is about 70 milliliters per beat. So if we multiply those two numbers together, 70 beats per minute times 70 milliliters per beat, that gives us an average cardiac output of 4,900 milliliters per minute, which is roughly about 5 liters per minute, 4.9 liters per minute. The average, typically bodies have a total blood volume of about 5 to 5.5 liters. So what this is telling us here, our cardiac output at resting is typically each half of the heart pumps a little under or about the equivalent of the total blood volume every minute. Now, during exercise, this cardiac output obviously increases and can increase to 20 to 25 liters per minute. We have a thing called cardiac reserve. Our cardiac reserve is the difference between our cardiac output at rest and the maximum amount of or volume of blood the heart can pump per minute. So cardiac reserve is something we can look at. So in general, cardiac output varies due to increased heart rate and increased stroke volume when engaged in strenuous physical activities. It kind of makes sense. If your heart rate is higher, there's more beats per minute, so you're able to push more blood through. If your stroke volume is larger, every beat you're pushing out more blood. So both of those things together add to increased cardiac output. Okay, so if we look at the next slide, okay, let's talk more about heart rate determination. Now with heart rate is determined primarily by the autonomic influences on the SA node. Okay, so the sinoatrial node, cardiac, or the autonomic influence of that is going to determine our heart rate. So heart is innervated by both divisions of the autonomic nervous system. So there's a sympathetic innervation and a parasympathetic innervation. The parasympathetic innervation comes from the vagus nerve, and this is primary supplies the atria, especially the SA and AV nodes. But there is a few or sparse innervation of the ventricle with the parasympathetic system. In the sympathetic system, on the other hand, it does supply both the atria and the ventricles, including the SA and AV nodes as well. But the ventricles in the sympathetic system are richly innervated, so lots of innervation to the ventricles here. Both of these, sympathetic, parasympathetic, bring about effects by primarily altering the activity of cyclic adenosine monophosphate, or CAMP, um, which is the second messenger pathway. Basically, this pathway, the acetylcholine that gets released from vagus nerve, um, from the vagus nerve, is going to bind to a muscarinic cholinergic receptor and is coupled to an inhibitory G protein that reduces activity of the CAMP pathway. So basically, what does that mean? Um, when acetylcholine gets released from the vagus nerve, a bunch of chain reaction things occur, which alters or reduces the activity of the CAMP pathway. By contrast, with the sympathetic neurotransmitter norepinephrine, it binds with a beta 1 adrenergic receptor and it's coupled to a stimulatory G protein that accelerates the CAMP pathway in targeted cells. So, by either inducing or suppressing the CAMP pathway, we can alter the heart rate. So, this whole CAMP pathway, the importance of it, CAMP pathway is what leads to the phosphorylation and altered activity of various proteins within the cardiac muscles. Um, so it could keep channels open longer or keep them open for a shorter time. So lots of factors that it could affect. Let's focus now on the parasympathetic stimulation of the heart. Um, in this case, the parasympathetic nervous system influences SA node to decrease heart rate. Okay, so parasympathetic decrease heart rate. Again, this works because acetylcholine is going to slow the heart rate by primarily increasing the potassium permeability of the pacemaker cells in the SA node. It does this by binding with the muscarinic cholinergic receptors coupled directly to the ACH regulated potassium channels by a G protein. Again, chain of events that links and it causes the SA node to fire less frequently. So if we look at this, it's going to do this all by augmenting the opening of these the potassium channels that are available, and the rate at which spontaneous action potentials occur or initiated is going to be reduced because by opening these potassium channels, we cause the SA node's membrane to hyperpolarize. In this case, more potassium or ions leave the cell, which makes the cell more negative and moves it further away from threshold. So further from threshold, it means it's harder to get it to excite and send that action potential. It also opposes the automatic reduction in potassium permeability that contributes to the development of the pacemaker potential. Again, it does this by decreasing the sinoatrial node's rate of spontaneous depolarization and prolonging the time required to drift threshold. So, also the acetylcholine, again, like we talked about in the last slide, it inhibits that CAMP pathway, which also depresses both the inward movement of sodium and calcium ions through the funny channels and the T-type channels, further slowing depolarization to threshold. Therefore, the SA node reaches threshold and fires less frequency, which decreases the heart rate. The parasympathetic nerves or stimulation here will also decrease the AV node's excitability. This prolongs the transition of impulses to the ventricles even longer than normal with that AV nodal delay. So we're extending the AV nodal delay here, which reduces the number of contractions that are going to occur. Again, by increasing the potassium channel's permeability, that hyperpolarization of the membrane retards the initiation of the excitation in AV node. The parasympathetic stimulation of atrial contractile cells shortens the plateau phase of the action potential by reducing the slow inward current carried by the calcium ions, which as a result, it weakens the atrial contraction. So shortened plateau, less chance to reset. So it decreases or weakens the atrial contraction ability. Now, the parasympathetic system has little effect on ventricular contraction because there's not as many connections between this system and the ventricles. So basically, the parasympathetic system is more in control during times at rest. So the heart's going to beat less rapidly. The time between atrial and ventricular contractions is going to be stretched out a little, and the atrial contractions are going to be weaker. This is appropriate because the parasympathetic system controls the heart action in quiet or relaxed situations. Okay? Now let's look at the effect by the sympathetic stimulation on the heart. Remember, the sympathetic system controls heart action in emergency or exercise situations where greater blood flow is necessary. So it kind of revs up the heart. So first, what this does, the sympathetic system stimulates the sinoatrial node to speed up depolarization so that threshold is reached more frequently and more rapidly. So this is caused by a greater inward movement of sodium and calcium ions through the funny channels and the T-type calcium channels, which causes a swifter drift to threshold, which allows for more frequent action potentials to occur, thus increasing the heart rate. Um, the AV node, sympathetic stimulation of the AV node reduces the AV nodal delay by increasing the conduction velocity, and as a result of this, it enhances the slow inward calcium current. Sympathetic stimulation is going to speed up the spread of the action potential throughout the specialized um, conduction pathway. And so in atrial and ventricular contractile cells, both of which have many sympathetic nerve endings, sympathetic stimulation is going to increase the contractile strength. So the heartbeats are more forcefully and it squeezes out more blood per beat. So the effect produced by this is increased calcium permeability through prolonged opening of the L-type channels, and then resultant calcium influx strengthens the contraction by intensifying the calcium participation in this excitation contraction coupling. Sympathetic stimulation is not only increases speed of contraction, but allows for greater influx of calcium into the cell through the L-type calcium channels, but it also speeds up relaxation by enhancing the circa pump that removes the calcium from the cytosol. So sympathetic stimulation of the heart, it's going to improve the effectiveness as a pump by increasing heart rate, decreasing the delay between the atrial and ventricular contraction, decreasing conduction time throughout the heart, and increasing the force of the contraction, all while speeding up the relaxation process so that more time is available for filling. So it kind of speeds everything up, which allows for more cycles to occur in a shorter amount of time, which provides more cardiac output. Now, if we look at control of heart rate, the sympathetic and parasympathetic systems have an antagonistic effect on the heart rate. At rest, the parasympathetic system dominates and the heart rate is slower. But in times of danger or stress, then the sympathetic system is going to take over and increase heart rate so that nutrients and oxygen can get to where it needs to be. So the vagus nerve of the parasympathetic system is going to inhibit the SA node, whereas the cardiac sympathetic nerves are going to stimulate the SA node. So again, antagonistic effects. All of this is coordinated by the cardiovascular control center in the brainstem, but there are other things that can help with this. Epinephrine, which acts similar to norepinephrine, will increase the heart rate, reinforcing the direct effect of the sympathetic nervous system has on the heart. So we take epinephrine for various things. Most common example that comes to mind, an anaphylactic. We give epi shots in order to bring the cycle back and get your heart racing and trying to get rid of the the toxin that's spreading through your system. So overall, parasympathetic, sympathetic systems work antagonistically to control the heart rate. Um, a different system is going to dominate at different times depending on what is necessary for the body at that particular time. Um, so to look at our objectives, we wanted to be able to explain what cardiac output is and how it works. Number two, we wanted to be able to explain the relationship between cardiac output, heart rate, and stroke volume. And finally, we wanted to compare and contrast the effects of the parasympathetic and sympathetic nervous systems on the cardiac output. Okay, here are my references, and thank you and have a good night.